Hi everyone, my name is Christine. I'm a trauma-informed artist, educator, and coach. And in this video, I will be sharing with you a short somatic practice that you can do after a surgery or an injury to help your body relax, heal, and recover. Now, I'm actually recording this practice before my surgery. I'm going to be having surgery on my left arm soon, and I'm going to be recording this ahead of time so that I can actually use this practice during my recovery as well. So you'll hear me reference things like the surgical site or the injury. In my case, that's going to be my left arm that I'm bringing my awareness to, but know that I haven't actually had my surgery yet. This is before, and hopefully this will support you after your recovery as well. I'm also going to be sharing my surgery process with you, making videos about my surgery, my recovery, and everything that I'm doing to prepare and to keep my mindset in the right place. So make sure to subscribe and hit the notifications button if you want to be the first to see those videos. All you'll need for this practice is a comfortable place to sit or lie down. You may wish to have a couple of extra props with you. You'll notice I have a blanket over my lap. I'm just sitting right on the floor. I have my hips propped up on a bolster here. I have a blanket on my lap because to me that feels comforting and grounding. May or may not feel comforting and grounding to you. And then you can also keep a pillow nearby. This pillow is just so that we can, hold it and squeeze it if we start to get stressed or activated. Even just having this pillow as kind of like a shield, I feel like it's guarding the front of my body. It makes me feel very safe and very cozy just to have this right here. I don't feel like I need it just yet, but I'm going to leave it off to the side. So find yourself a comfortable place to lie down or sit down where you won't be disturbed for the next couple of minutes. And then if you want to have some extra props, you're welcome to. You may not feel like you need them. So when you're ready, find your comfortable place to sit or lie down. And just start settling into your space, maybe stretching, taking any wiggles. You may have had surgery really recently, so it may be hard to move certain parts of the body. That's okay. Just get as comfortable as you can given the circumstances. And I invite you to just take a deep breath in. Settling into the body. We'll exhale together, emptying the lungs. And at your own pace, take another couple deep breaths. Just heard my belly making some noise, so that's a good sign. If your tummy's rumbling, it means your body's downshifting into that rest and digest state. That's a good state we want to be in for recovery. That deep breathing can help with that restful state, especially those long exhales. Taking an inhale, there's my stomach talking. Long exhale. Full exhale, emptying the lungs until you feel like you're ready to take the next breath. Feel like you want to move some parts of your body. For me, it's my jaw just wants to release a little bit. Free to make noise as you breathe. We're just bringing the awareness into the body here, slowing down, releasing anything that happened earlier today or anything that might happen later. When you feel like you're starting to be comfortable, downshifting, I'll invite you here to just look around the room, moving your head, but not just turning your head. Also try to move your eyes. So really like the eyeballs, allow them to shift around the room. And notice your space. Maybe there's, piles of mail or laundry or stuff in the space that you wish wasn't there. That's okay. We're just going to let that go for now. You can come back to it another time. Notice firstly that if you're doing this practice, you are at least somewhat safe. If you have the space here, it means that your roof is not actively falling in on you as you're watching me here on YouTube. Even if you live with someone who you maybe don't feel super comfortable around, if that person's not here right now, look around your space and notice that they're not here. Maybe that feels good. As we're looking around, just notice what feels good about your space. Orient yourself to the room. Maybe there's an object here that you find particularly beautiful or that holds good memories for you. And I invite you to maybe pick just one. For me, there's like a sun catcher with little crystals hanging in my window, and that's particularly beautiful to me. So that's going to be my resourcing object. If you start to feel ungrounded or you start to feel triggered or upset at any point during this practice, you can just look to your resourcing object, that thing that brings you the good feelings, and focus on that for a while. So when you have yours, kind of notice that. Notice if there's anything that feels really comfortable as you think about that thing in the room. And then I invite you to notice what that feels like in your body. Whatever positive emotion or sensation you're associating with that object in the room, really feel into it. For me, it feels like a smile. I can feel this lightness in my face. Maybe there's nothing that you can put your finger on. That's okay. If that's the case, I would just invite you to find a place in your body that feels good. For me, my feet feel really good. I have these cozy socks on and my toes feel really warm and kind of snuggled in the socks. And if you can't find a place in the body that feels good, maybe just look for a place in the body that feels neutral. It doesn't have to be a big space. It could just be a pinky finger, maybe where there's no sensation. And if this is already starting to bring up activation, tension, maybe feeling like you want to cry, feeling like you want to get out of your own skin, that's okay. If that's the case, I would invite you to maybe place a hand on your heart, or maybe that's when you grab your pillow or a stuffed toy, hold it against you. So allow those emotions, that tension, activation to move through you like a wave here. You need to cry, that's okay. We're trusting that whatever comes up needs to be here. It needs to move up and out of the body. As long as you feel safe, as long as you feel like you can handle the emotion and the sensation that's coming up, we can keep going. You can stay with that sensation. If you're starting to feel overwhelmed, like this is too much, that's okay. You can pause the video and come back to it later. Just really trust yourself here. Maybe you want to just take a break and feel the pillow. Look at your resourcing object. Remember the good feeling that you have when you look at that thing. Maybe you notice what your clothes feel like or what the surface feels like underneath you. See if there's something in the room that you can smell. Even if that's like you can smell yourself, that's okay. Anything that's engaging your different senses, your sense of touch, your sense of smell. If you have water nearby, maybe you take a sip of water, you feel what it tastes like in your mouth. Just feeling into those senses is also going to help ground us in the body. Knowing that even if we have pain, even if we have an activation that feels stressful, that there are other sensations happening at the same time. And we can kind of dip in and out. Maybe we notice the pain just for 1 second. And then we notice what, the lotion smells like from our bedside table, or we notice what our socks feel like on our feet. I like to say, what else is true? Yes, I have just had a surgery, thinking this is in the future. Maybe you've just had a surgery or an injury. Maybe it's painful. Maybe it's bringing up these feelings of activation and stress and discomfort. Okay, what else is true? Are there also birds singing outside your window? Is there a candle in your room that smells good? Is there something beautiful that you can look at? It's never black and white, right? One extreme or the other. There's always multiple things going on inside of us, around us, all the time. So just taking a moment to think about all of the things that are true. Nothing has to be excluded. All the things that are true for you in this moment. Maybe you feel terrible. Maybe you're feeling unwell and in pain following surgery. And also, someone in your life made you some really delicious food today. Both things are true at the same time, right? Just coming back to the body, feeling into whatever sensations are coming up for you. And if you have a sensation that feels really strong, maybe you just kind of ask your body, what do you need? Does my body need to be held right now? Do I need to cry? Do I need to scream? Do I need to punch a pillow? That may or may not be possible with your injury. If not, we're going to find a substitute, right? That may be lower impact. But whatever activation is coming up for you, when I think about my arm that I'm about to have surgery on, I already feel tension and activation just from the fact that I have a prior injury there. I've had surgery there before. The muscles, the tendons are inflamed. It's sore. And so I feel that discomfort. And I'm just going to allow myself to feel it. There's no right or wrong way to do this. Welcoming in those sensations, reminding myself that I can handle it. You might say to yourself, I can handle this. Breathing into them, not resisting the sensations. Allow yourself to breathe. Maybe your body wants to tense all your muscles, and then you tense, and then release. Your body lead the way. Yeah, I feel like my arm here really wants to be held. So I'm going to allow myself to do that and rock side to side. That feels soothing to me, but something else might feel soothing to you. And as you feel into your body here, your surgical site, your injury, I invite you to imagine that any pain or any tension is just melting away. Like it's flowing down your body. You might imagine this as a thick, oily liquid, like goo flowing out of your body. You might imagine it like something else. So just notice if you think about this pain or this stress, what color is it? What texture is it? Is it like smoke or is it like liquid? What's happening? If you could visualize this discomfort, allow it to be there and then send it away. Gratitude, we're releasing this pain, releasing this stress. You might imagine that you have roots coming out of the bottom of your feet like a tree. And maybe these roots are going into the earth and all of the pain, all of the discomfort is just leaving your body, flowing down your roots into the earth. Let it be absorbed. Maybe it resonates with you to ask someone else, a higher power, maybe a pet, an ancestor. Imagine them here and ask them, please take this discomfort, take this pain. You may ask for healing. Help me heal. Just imagine a supportive figure with you now. Maybe a supportive element in nature, maybe like a beautiful tree. Whatever you're visualizing, sense in their loving energy. I like to think about Mother Earth supporting me, enveloping me. Maybe there's a figure from your faith tradition. Imagine them here with you now, sending you this love, this energy. And as that pain, that tension, that stress leaves your body, maybe you imagine this loving figure enveloping you with light, with healing, warmth, and love. Imagine this healing energy flowing in. I'm imagining mine like a golden light flowing down my arm, healing the cells. This light is coming into every cell, repairing skin and tissue and maybe bone. Everything after your surgical procedure, imagine it stitching itself back together, healing stronger and better than it ever was. And we're just going to take some time now to really feel into that healing. Imagine your injury or your surgery site as healed. Imagine that the healing is already complete. What will that feel like in your body? And you grow that sensation. Maybe it feels like warmth or light. And you grow that warmth throughout the body until your entire body is just pulsing with this healing energy. Imagining when that place in your body is healed, what will you do? And for me, I'm going to be having arm surgery, and one of my hobbies is basket weaving. So I'm really looking forward to the point in my recovery when I'll be able to get back to basket weaving again. Maybe you have something like that. You visualize yourself playing your sport, doing your hobby, connecting with the ones you love. I can't wait to be able to use both my arms to walk my dog. Imagine yourself with that healed place in your body. Maybe 6 months or a year after your surgery. You've fully healed. What would you be doing? Who would you be sharing the moment with? Or would you be savoring the moment by yourself? Imagine yourself doing that thing, feeling the energy, maybe feeling what the wind is like over your face. Imagining that it's happening right now. What does it feel like? What can you hear? What can you see around you? What do you smell while you're doing this thing? Fully recovered. Feeling energized and confident. Maybe you place a hand on a heart or a hand on your belly. Connecting into the sensation, allowing this positive sensation to flow through your body now. And really lock it in. Knowing that this is possible for you, that this is your future. Your body is healing. Trust that you know how to heal. I invite you to open your eyes gently, blinking if your eyes have been closed. I invite you really to just notice as you go through the rest of your day, trust in this healing. The more that you do this visualization practice, the more real it becomes, because our brains actually can't tell the difference between what's real and what's imagined. So you can imagine yourself recovered, thriving, doing your thing as often as you want, and you're kind of priming your brain to go in that direction, to believe that it's already happened and to believe that it is happening for you. I hope you found this helpful as you reorient to the space. Maybe you just sense into how your body's feeling now and notice if you're feeling any different from when we first started. You may want to look around your space again, adjust your body if you need to, stretch if you need to. Maybe you find your beautiful object in the room again. Take a few deep breaths as you settle back in. I'm wishing you a wonderful recovery, a great rest of your day. Remember to take this positive energy with you throughout the rest of your day. Thanks for practicing with me, and I will see you in the next video.